This is Kim Hester, and with us today on Your Town is Dana Price. She's the cardiac and pulmonary rehab director here at Fleming County Hospital. And with February being Heart Awareness Month, this is the perfect time for you to talk to us, Dana, about heart health.
Okay, heart health involves a lot of things. Here at the hospital alone, not mentioning cardiac rehab yet, we offer stress testing for patients. That tells if they have a blockage or something that needs, if they have an abnormal EKG, then they'll come in for a stress test. Dr. Ragu visits here. He comes here on Thursdays. He's a cardiologist in Maysville. So we do offer cardiology services here at Fleming County Hospital. We're always looking to add new patients. We also have cardiac rehab and pulmonary rehab, but we're going to focus on cardiac with it being Heart Month.
Sure.
And cardiac rehabilitation helps improve your heart's future. Cardiac rehab is a medically supervised program designed to improve your cardiovascular health if you've experienced a heart attack, heart failure, angioplasty, or heart surgery. It's a medically supervised program. So Stacy Maston is the employee in there, and our hours of operation are Monday, Wednesday, Friday, 6 a.m. to 6:30 p.m. We offer exercise counseling and training. Exercise gets your heart pumping and your entire cardiovascular system working. You'll learn how to get your body moving in ways that promote heart health. Education for healthy living, a key element of cardiac rehab is educating yourself. How can you manage your risk factors, quit smoking, make heart-healthy nutrition choices, and also counseling to reduce stress. Stress hurts your heart. This part of cardiac rehab helps you identify and tackle everyday sources of stress.
Okay.
So you don't need to face heart disease alone. Cardiac rehab is a team effort. We'll partner with the doctors, the nurses, pharmacists, respiratory therapists, family, friends to take charge of the choices, lifestyle, and habits that affect your heart. So it's a whole team effort, and we are in direct contact with the patients, physicians, with their cardiologists. You know, of course, we have to get the referral from them.
And you follow up with them as need be.
Yes. Throughout the entire program, they are followed up with. They get progress reports. If patients are interested, they can ask their doctor if they're eligible. They'll consult with us. We'll set the goals, see where that patient wants to be, work together to create a plan, and help them achieve those goals. A lot of times, people's medications are an issue, so that's why we partner with pharmacists to ensure that patient is on the correct dosages, correct medications, and so forth. Following a diagnosis of heart attack or heart failure, or after a procedure such as an angioplasty or heart surgery, participating in cardiac rehab is one of the best things that a patient can do for their heart. It helps them regain control of their health.
Sure.
It can lower your risk for a second cardiac event. It's a path to feeling better than before. We give you all the resources to eat better, lose weight, return to work if they have been out of work, engage in daily activities that they might have missed. And a lot of people wonder, is it right for me? People of all ages can benefit from this. Your younger people will have had mitral valve replacements, different things like that. That does qualify them for cardiac rehab if they've had those issues.
Okay.
But, again, if a patient has experienced a heart attack, heart conditions such as coronary artery disease, angina, heart failure, heart procedure, surgery, including coronary artery bypass graft, let's see here, valve replacement, pacemaker, implantable defibrillator. A lot of patients have those. Those are all cardiac rehab candidates.
Okay. Yeah.
Yeah.
So a lot of different cases
Right.
can lead you here.
Right.
Yeah, and you
Right.
can benefit from it.
Right, right. And it does require a referral from their physician.
Mm-hmm.
It can be their family physician or their cardiologist. Most of ours come from cardiologists because it's following a surgery,
Mm-hmm.
but it doesn't have to. And if they have problems reaching their physicians, we have contact with those physicians on numerous times a day.
Okay.
So whereas if they may not be able to get the referral,
Mhm.
we can.
Mm-hmm.
All insurances will cover cardiac rehab if they have the proper diagnosis. They
Okay.
may not cover 100% of it.
Mm-hmm.
They may have a copay, they may not. It depends on their insurance plan. But we also let them know that ahead of time. We let them know their financials before they start anything.
Okay. And for Medicare patients.
Exactly. Yes,
Okay.
we have Medicare patients, several
Uh-huh.
of them,
Okay.
and we also have what we call the Phase 3 program.
Mm-hmm.
That's after they finish Phase 2, which is the cardiac rehab. And we have Phase 3, and that's the maintenance program where they come in and once a month they pay a fee,
Uh-huh.
but they're able to use the treadmill, the ellipticals, the weights. They're still allowed to come in there and work with Stacy
Okay.
to maintain where we have got them thus far.
And of course, you mentioned, and as we've talked before, that's a minimal charge, right?
Yeah, the $25 is Phase 3.
That's okay.
That is that never changes.
That never changes,
Mhm.
and that's per month. Okay.
Yeah, for as
All
long
right.
as they want to do it.
Okay.
Now we have had some patients that have decided not to do it after a few months, and then they usually come back for another Phase 3,
Mhm.
or you never know. It's basically based on circumstances, but they love it. It's a social thing
Yes.
as well. So they get to catch up on everything. They get to see other patients with the same issues or different issues, and it also gives them, I don't want to say something to do, but it's something to do that is healthy,
Mhm.
that's helping them with their overall health,
Yeah.
not only with their heart. So we provide counseling for, if they suffer from depression or stuff like that.
Which is kind of normal with some heart procedures, is it not?
Oh, yes.
Uh-huh.
Yes, it's very common. We help them, we give them ways to cope, ways to deal with things that have happened. You take a person that is overall healthy, but yet they've had a cardiac event. Let's say they had to, have an open heart. Okay, it does affect them emotionally.
Yeah.
So, yeah, we just kind of give them tips on nutrition and diet and, counseling for how to cope with, that type of event happening in your life, because it's life altering for a bit.
And understandably so, but then, you've got that camaraderie with other patients, and you can,
exactly.
and I think, I know myself, if I'm going through something and I find somebody that's very similar, it
Right.
gives you, it
Right.
supports you.
Yes, and they are always finding ways to celebrate something in cardiac
yes,
rehab.
we love to celebrate.
Yeah, so I think their next one is the Super Bowl. Even though we're not open on Sunday, they'll have a little get together for the Super Bowl. They did the Little League World Championship party. And it's always something. So they're always looking for ways to.
I love it.
Yeah,
Yeah.
ways to celebrate.
Friday will be Super Bowl day here at Fleming County Hospital.
Yes.
Okay, Rhea.
Definitely, yes. So,
All right. Anything else?
well, I've went over that it does require a referral, but if they have trouble getting that from their family physician or their cardiologist, we can help with that.
Okay.
Our phone number is 606-849-5184. That's our direct extension back there. So if they don't get us, they can leave us a voicemail and we will get back to them. Cardiac rehab, it provides a healthier future for patients.
Definitely.
So, help them live longer, better quality of life. So, it's a great program if they come, and you just kind of have to be there to to believe it, because it's a fun program as well. So
And Fleming County Hospital heart rehabilitation is a wonderful asset to this community, to this hospital, and to this community, because people
Yes.
don't have to drive
exactly
50, 70 miles.
exactly, with gas prices and
Mhm.
everything, as it is, they
Right.
can get the highest quality care right here at Fleming
home.
County Hospital at
Right.
home. Yes, they do
Yeah.
not have to drive, and they're going to know the other patients. They're going to be right here at home.
As your motto says, Fleming County Hospital, making communities healthier.
Exactly.
All right. Anything else?
No, I don't think so.
Well, thank you so much, Dana Price. It's always a pleasure to have
Yeah.
you on, and
It's a pleasure to
especially
have you.
yeah, especially your Heart Month.
Yes.
All right. And if this is something that is indicative of a situation that you have, again, call Fleming County Hospital, and the number again, Dana, is
606-849-5184.
Thank you so much.
All right. Thank you.